Okay, so we have Megan here that we're going to be doing several amazing treatments on. First, we are going to use our amazing steamer, soften up the skin, open the pores up, and of course do a great cleanse. And then we're going to do our wet microdermabrasion, which is our DiamondGlow. It's a 3-in-1 treatment. Okay, so we're going to exfoliate, we're going to extract, and then we're going to infuse a customized serum deep into the subdermis of the skin. And it actually stays with you for a minimum of 3 days or more, okay? Then, once we're done getting our glow on, we are also going to continue our glow with other multiple benefits with the light stem, so red light therapy. And then I'll go over that at that time. The light stem is amazing. It has several benefits from acne, anti-aging, and then it also does some other things as far as recovery, okay, for the body and different things. They're also finding how great it is for post-recovery. So let's say you had surgery or you had a CO2 laser. You want to pop on in when it's okay to do so, and it will start working on that inflammation, on your redness. And then what we're seeing right off the bat, obviously, is a great glow, texture and tone, and just a brighter, a luminous skin tone. So, and of course, anti-wrinkle, right? So it does work on your wrinkles as well, and any bacterial pimples, so acne. Okay, so let's go ahead and get started. So results are seen immediately with the DiamondGlow. And what we can do is take before and after pictures, but I'm telling you right now, you will notice because the skin is instantly brighter. It has a beautiful glow. So that's what's super great about this treatment, is that you don't have to wait for results. And although you have improved results with doing more than one consistently once a month, that will only give you greater results. So with the DiamondGlow, just to kind of point out what I'm doing and what everything is, the tip is actually a diamond, cut up diamond. So it's a diamond tip that's going to exfoliate, okay? I'm going to prime it, and the serum that we're using, which is the TNS, is going to prime into this cap and also be there readily to go into the pores. Okay, and then I also have a vacuum suction that is going to be working at the same time, pulling things up and off. Okay, so that's what everything is here, and this is obviously the hand piece. And then I can adjust my settings on how much serum comes out and how high my vacuum is. We also have a different hand piece that's for the body. So we can actually treat larger areas. And if you have inflamed acne, we also have a different attachment, so it's not so rough on the cystic acne. Okay, so I'm going to start off with the right side of this lower lip here. And even though you have very beautiful, voluptuous lips already, you're still going to see and notice a difference after I work on it, how plump it gets. And you will be able to tell a difference between, obviously, from the other side of not working on it. Okay, so what's great about the lips is there is so much dry, dead skin on there that you don't even realize. And that's the big chunks that I normally see in the jar. It is not going to stay this big, but the fact that you can see how big that lip is now and just bright and juicy is amazing. And I work on all skin types with the DiamondGlow. I have a lot of patients who have rosacea, and they handle this treatment just fine. So in the beginning, when I was speaking to Megan about some of her skin concerns and what she is wanting to work on, it was anti-aging. Okay, that's always a concern. So why not pair an even greater treatment and just boost their results? We did the TNS serum with the DiamondGlow, right? So let's continue that anti-aging treatment and throw in the light stem. Okay, so we can work on all those wrinkles. Again, texture, tone, get that real bright, luminous glow, that youthful glow, and tight, lifted skin as well. Okay, so if I put a light underneath our jar, but first I'm going to mix everything up so we can get it off the bottom. And then you'll start to see.
Oh yeah.
Look at all those amazing floaties in there.
There's a big one.
Isn't that great? That has to be from the
I
lips.
bet it does have to be from the lips.
Mm-hmm.
That's crazy.
This would be the jar of the week.
That's crazy.
So all of this was on your skin. So all this is gone now.
Yay.